Hello, my name is Dr. Joanie Winstead. I am a graduate of the prestigious Palmer College of Chiropractic in Davenport, Iowa. I am a board-eligible chiropractic neurologist with over 300 hours of postgraduate neurology through the world-renowned Carrick Institute in Atlanta, Georgia. I also have in excess of 150 postgraduate hours in functional medicine and metabolic testing through Apex Energetics. These classes include functional endocrinology, functional blood chemistry, neurotransmitters in the brain, and mastering the thyroid. I have been in private practice in Carthage, Mississippi since 2004. I am a graduate of Dr. David Clark's master's class in the functional neurology and functional medicine of type 2 diabetes. According to the functional test ranges, I am a diabetic, and I have a family history of diabetes, but I have changed my life using the information I am about to share with you. You are watching this video today because you or a loved one are suffering from diabetes, or you have the symptoms of diabetes and are concerned that your life will change forever when you develop diabetes. First, understand I am not saying to not see your family doctor and continue with his or her care and follow their recommendations. Please don't misunderstand me. I'm also not telling you to stop taking any medications. Do not stop any current medications that you are taking, period. During this video, you will also find out the truth about your problem and how to get rid of it once and for all without drugs or insulin. Diabetes is a sneaky, potentially disabling epidemic that is sweeping across America as we speak. Many of your family, friends, and co-workers will experience the same experience that you do because of a number of factors, including misinformation and inappropriate care. That's why I've taken the time to make this video. So keep watching to find out what many doctors don't know about diabetes. Before we begin, please understand that uncontrolled diabetes can affect your vision. It can cause blindness, loss of limbs, your kidneys, heart and cholesterol levels, risk factors for stroke and cancer. You see, what's so dangerous about diabetes is that it's not an injury like a broken bone or a cut or a scrape. Diabetes usually comes on slowly. You don't notice it at first, or maybe you just brush off the initial symptoms such as frequent urination or thirst, and you think it's nothing, and then it slowly builds and builds. You may start feeling numbness and tingling in your extremities, and you may become more irritable. And then one day, you realize you just aren't the same person you used to be. And that's when you go to your family doctor to get checked out. Most doctors do great with general medicine. If you have an ear infection or a severe cold, medical science can do wonders. But when it comes to a condition like diabetes, many doctors simply run a fasting blood test. They find out that your blood sugar is high, and they give you a medication or put you on insulin if your blood sugar level is really high. But they never perform a full battery of tests to get to the very cause of your diabetes. That's right, most doctors don't run enough tests to get down to the nitty-gritty of what's causing your blood sugar to increase, even on medications. Diabetes is a tricky condition. You see, your diabetes can have a number of causes, and some of those causes aren't even in the area where you might expect them to be located. Your adrenal glands sit right above your kidneys, and they are your stress glands. They play a huge role in your diabetes. Your thyroid controls your body's metabolism, and it plays a huge role in your diabetes. Many doctors do not take the function of these organs into consideration when addressing your diabetes. With that being said, here are the dark secrets. The main problem with treatment some doctors prescribe for diabetes is that they never get to the root of the problem. They only focus on the symptoms. That is all well and good, but there is much, much more. If you are taking pills so you can get through a day of work, then you are probably making your problems worse because you sabotaged your body's only means of keeping you healthy. Obviously, this form of treatment is not a permanent fix. No matter how many pills you take, you'll never get completely better. Okay, so you've done the pills and they don't seem to be working. Well, what's next? Typically, insulin injections. The problem is, insulin at high levels can cause a host of side effects like weight gain, increased blood pressure, cardiovascular disease, increased risk of cancer, and increased risk of stroke. All diabetic medications are simply treating the symptoms of high blood sugar, while your disease continues to progress to possibly reality of insulin therapy. It's not that your body is lacking the hormone insulin. The problem for the majority of diabetics is that insulin resistance has set in. This basically means that your body has lost the ability to utilize insulin appropriately. What sense does it make to continue to bombard the body with something it no longer recognizes and can no longer process, especially when that substance, insulin, may be harmful to your health and more than likely will cause your disease to progress. The definition of diabetes, according to the American Diabetic Association, is 2 fasting blood tests with a blood glucose level of 127 or higher. 100 to 126 is termed prediabetes or insulin resistant, and anything below 85 is hypoglycemia. So your functional blood sugar level or blood glucose level should be 85 to 99. Now think for a minute. Imagine how life would be if you no longer needed the drugs. Imagine how life would be if you no longer had to inject yourself with insulin. Imagine if you had the energy to exercise and lose the diabetic weight. Imagine what life would be like without having to get up constantly throughout the night to use the restroom. Imagine what life would be like without living in constant fear of the devastating effects of this disease. But let's start with what makes my office completely different from any other doctor that you have seen up to now. Number 1, complete neurological testing with exercise with oxygen therapy. Your body needs 2 things to survive: fuel and activation. Fuel comes in the form of glucose, blood sugar levels, and oxygen. By having our patients exercise with oxygen, we can lower their blood sugar levels naturally. Your brain and nervous system controls every bodily function, so in order to effectively treat and control your blood sugar levels, we must thoroughly test and treat you neurologically. We have decreased blood sugar levels with many of our patients simply by putting them on exercise with oxygen therapy. Number 2, complete and thorough metabolic testing. Has your doctor specifically checked for an autoimmune disorder? There are 2 parts to your immune system, Th1 and Th2. If one of these parts is dominant, you can have an autoimmune disorder. An autoimmune disorder is where your immune system is attacking your body, causing your diabetes. For example, you could have an autoimmune disorder in which your immune system is attacking your pancreas, and this is why you have increased blood sugar levels. Has your doctor specifically checked you for any food sensitivities that could increase your blood sugar levels? Each time that you eat a food that you are sensitive to, such as gluten, which is wheat, barley, rye, and oats, dairy, eggs, soy, or yeast, it can increase your blood sugar levels. This could be why, even though you are taking medications and exercising, your blood sugar levels keep increasing. Has your doctor run a complete thyroid panel? Your thyroid controls your body's metabolism, so if you suffer from diabetes, it must be thoroughly checked. I'm not talking about a simple test for TSH, which is a thyroid stimulating hormone. I'm talking about the complete battery of thyroid tests. Has your doctor checked your adrenal glands? Your adrenal glands are your stress glands, and they are just as important as your pancreas is in treating your diabetes. An ASI needs to be run on you, which will check your cortisol levels. Has your doctor checked you for blood disorders such as anemia? You need these blood levels checked if you are suffering from diabetes. Hormone levels are very important in controlling diabetes. And if you've answered no to any or to all of the questions, then there's a good chance that your diabetes is not being properly managed. These tests need to be run on you to get to the bottom of your diabetic condition. Anything less means that you are in for years of misery. Can you see that by treating you neurologically and metabolically, we can help you? I want you to know the truth about diabetes that almost everyone out there doesn't seem to want you to know. I know that chances are great that I can eliminate or at least greatly reduce your weakness. My free evaluation. If you are currently suffering from diabetes, don't procrastinate. Just complete the information in the box below and we will schedule you for a free evaluation. I hope you've benefited from discovering the truth about diabetes that, believe it or not, most doctors aren't even aware of. So get this free second opinion before it's too late. Our office is extremely busy and we only accept 4 diabetic consultations per week. So don't procrastinate. Sign up to get your free evaluation. Congratulations on taking responsibility for your own welfare.